Hello everyone and welcome again to the Medical Technology Assessment Program for Clinical Parasitology. So we're still under the phylum Platyhelminths, but we will be focusing our attention to the class Trematoda, or what we call the flukes. So here are the general characteristics of your trematodes or flukes. So the first one, your flukes or trematodes are leaf-like, just like here on this picture. So exemption would be the schistosome or blood flukes, which are cylindrical. Next one, compared to your cestodes, your trematodes are unsegmented. So there are no presence of segments, just like your gravid, mature, and immature segments. So for trematodes, the presence of their esophagus, intestines, and other organs are compiled into one single body of the worm. There are no presence of circulatory system, but they do have digestive tract, which is incomplete compared to your cestodes that do not have. And lastly, for trematodes, most of them are hermaphroditic. So that means these are monoecious. So there is only the presence of one single adult worm, except also for your blood flukes or schistosome. So your schistosomes are dioecious, or there is a presence of a male and female adult worm. So here are the species that we will be discussing under the class Trematoda. So your attachment organ that is present to all your flukes are usually in a form of acetabulum. So there is the presence of two suckers, which is located orally and ventrally. For heterophytes, kindly take note that it contains an additional sucker, which is called your gonotyle. So this is located at the genital portion of the particular parasite. So heterophytes species is special, which contains 3 suckers. Okay, the third sucker is also known as your gonotyle. So let's talk about first the organ-dwelling trematodes. So when we say organ-dwelling trematode, that means these particular parasites usually invade the organs of our body. So we have your liver, intestinal, and lung trematodes. So most of these, or all of these rather, okay, contains eggs that are operculated. So what do we mean by operculated? So here is an example. So eggs of your organ-dwelling trematodes are operculated or contains operculum. So this is a lid-like structure that opens up once the particular miracidium is already developed. Next one, in terms of their larval stages, for the organ-dwelling trematodes, we have 5 different stages. No? So we have your miracidium, sporosis, redia, cercaria, and metacercaria. So the metacercaria here is the infective stage of your organ-dwelling trematodes. Next, in terms of their adults, since these are mostly organ-dwelling, that means these particular adults are flat, leaf-like with acetabulum or sucker. And most of these are hermaphroditic in nature. So there is the single adult worm present in a single host. In terms of their definitive hosts, the cattle and humans serve as their definitive hosts, while for intermediate hosts, they require 2, okay? Which usually snails as the first intermediate host, while other aquatic animals and plants serves as their second intermediate host. The mode of transmission of these particular parasite is ingestion. Next one, we have your blood-dwelling trematodes or schistosome. Although we have 5 major schistosomes, we will only be discussing the 3 clinically significant blood flukes. We have your Schistosoma mansoni, your Japonicum, and Hematobium. So let's talk about first their egg or ova. So their egg, compared to your organ-dwelling, your schistosome eggs are non-operculated, but with the presence of spines or knobs. Just like here on this picture, as you can see, this is the S. hematobium ova or egg. So the presence of a terminal spine indicates the parasite Schistosoma hematobium. In terms of their larva, so we have 4 stages or larval stages, with cercaria being the infective stage of the parasite. Your schistosomule, on the other hand, is the larval stage present on the human host. Next, in terms of their adults, so for their adults, unlike your the normal trematode fluke, which is a leaf-like, for schistosomes, these are elongated and cylindrical, just like a normal worm. So they are also dioecious, which means there is the presence of a male and female adult worm. And lastly, in terms of their life cycle, the definitive host would be humans as well, and cats and dogs. In terms of their intermediate host, they only require one intermediate host, and that would be the snails. So unlike your organ dwelling, the mode of transmission of this parasite is skin penetrations. Skin penetration rather. So because of the presence of the infective stage Cercaria, which is a larval stage, just like we have discussed a while back in our previous topics, when most of the time when the infective stage is a larval stage, the mode of transmission is usually skin penetration. So before we start with the parasites, let's talk about first the mnemonics that are helpful in your reviewing for this particular topic. So for ovoviviparous females, especially in your trematodes, don't forget the mnemonics shock MD. So this stands for Schistosoma, Heterophyid, Opisthorchis, Clonorchis, Metagonimus, and Dracocoelium. Next, in terms of oviparous, so that means these are immatured when laid. So these, don't forget the word PEF. PEF stands for Paragonimus, Echinostoma, Fasciola, and Fasciolopsis. In terms of their first intermediate host, most of all your trematodes are or require snails or mollusks as their first intermediate host. In terms of their second intermediate host, so for fish, we have hawk, which stands for Heterophyid, Opisthorchis, and Clonorchis. While for plant or vegetation, we have your 3 Fs, so that stands for Fasciola hepatica, Fasciola gigantica, and Fasciolopsis busci. Next one, for crab, don't forget the words crab paste. This stands for Crab P. westermani. Next, for both snails, so don't forget the Echinostoma ilocanum. So this parasite requires snails as their first and second intermediate host. And lastly, for ants, we have your Dicrocoelium dendriticum as their second intermediate host. So let's start first with the liver flukes. So we have Fasciola hepatica as the most commonly associated or pathogenic liver fluke among these types of trematode. So the first one is Fasciola hepatica. So this is also known as the temperate liver fluke. Okay, so this is more common on cold climates such as in Europe. This is also known as the sheep liver fluke. So this is one of the causative parasites that causes a death in livestock such as sheep. So the pathology behind this is fascioliasis, and the target organ is liver, hence the name hepatica. So liver, this is where the larva of the parasite mature, while bile ducts, okay, adults are seen in the bile ducts, which connects your liver to other parts of your body such as your gallbladder and so on and so forth. So the infective stage of this parasite is metacercaria, since this is under organ dwelling. In terms of their definitive host, kindly take note of the sheeps or ruminants. When we say ruminants, these are plant-eating animals. So humans act as definitive hosts as well, but most of the time we are accidental hosts. Okay? So later we'll discuss how humans are accidentally get infected with this parasite. So the intermediate host of this parasite is snails under the genus Limnaea. So since this is under the 3 Fs, your Fasciola hepatica, so the second intermediate host of this parasite is aquatic plants. Okay, under the genus Ipomea, or what we call the morning glory or kangkong, and Nasturtium officinale or watercress. So the mode of transmission of this parasite is through ingestion of encysted metacercaria in aquatic plants or contaminated aquatic plants. The morphology of this parasite in terms of their egg is resembles hen's egg appearance with flat operculum, just like here on this picture. So in terms of the adults, these are leaf-shaped with distinct shoulders and a branched ceca. So when we say ceca, this is the intestinal organ of our parasite. So just like here on this picture. So as you can see, this is leaf-shaped, which is common to all organ-dwelling trematode, and the presence of your shoulders. So in terms of the pathology for Fasciola hepatica, the most common one is the enlargement of your liver or hepatomegaly. So this causes destruction also with your bile ducts surrounding your liver and other organs. Other pathology behind this parasite is ectopic. So pag sinabi natin ectopic, this means that outside the liver. No? So we have your lungs, subcutaneous tissue, very rare, but this can also travel down to the brain and the orbits of your eyes. Halzun and Marara, this is a term of ingestion of raw Fasciola infected liver, which causes hemorrhagic nasopharyngitis and dysphagia. So when we say nasopharyngitis, this is an inflammation of your nasal passages and pharynx. Most of the time, since this is hemorrhagic, that means the expectoration of blood, okay, from your nose is very evident. Okay, dysphagia, on the other hand, is the difficulty or discomfort in swallowing. This, in terms of the zoonotic disease, so this causes sheep liver rot, based on the word itself. So these particular parasite destroy the livers of the infected sheep. So here is an example picture of the most common pathology of Fasciola hepatica. So as you can see, on the first one, this is a normal liver, cross-sectional liver in a normal person. So as you can see, the bile ducts are very normal with no presence of blood or enlargement. While here on this picture, this is an abnormal infected liver. As you can see, the bile ducts are enlarged, and the presence of blood may be described as well. So, parasitological diagnosis may be made through the identification of eggs in stool, or we can also use duodenal aspirates or contents with the help of your enterotest. So, the recovery of adult worms can also be acquired during surgical exploration or after treatment or autopsy. So, the most commonly used methods to identify this species is through serological and immunological testing, such as your ELISA and gel diffusion tests. So, the prevention is through proper human fecal disposal. So, the next one is Fasciola gigantica. So, from the species name gigantica, so this means this is the giant liver fluke or the tropical liver fluke. So, compared to your Fasciola hepatica, which is present on cold countries, your gigantica is more common on tropical countries such as the Philippines. So, this infects the cattle here in our country. And in terms of the morphology, this resembles Fasciola hepatica. So, the egg is slightly larger and the adults are slightly longer. So we're done with Fasciola hepatica, Fasciola species rather. Now let's move on to Clonorchis sinensis. So this is also known as the Chinese liver fluke or the Oriental liver fluke. So this causes Clonorchiasis, which we'll be discussing later on. And the target organs is still liver and the bile ducts for adults. So the liver for maturation of your larva, while the bile ducts is invaded by the adult worms. The infective stage is still metacercaria and the diagnostic stage is embryonated egg. So for the life cycle of Clonorchis sinensis, the definitive hosts are still humans. Fish-eating mammals can also act as reservoir definitive hosts, such as your dogs and cats. The intermediate host of Clonorchis is a snail, the first one, and the second one would be the freshwater fish, under the genus Cyprinidae. So the mode of transmission for this parasite is through ingestion of undercooked fish. So in terms of morphology for Clonorchis sinensis, the egg resembles a old-fashioned electric light bulb. So this is equipped with a distinct operculum, which is most common to all organ-dwelling trematodes, opposite a small knob. This is also the egg form that contains a thick rim surrounding the operculum, or what we call the shoulders. So again, for the egg form, the one with a shoulder is your Clonorchis sinensis, but for adult forms, the one with a shoulder is your Fasciola hepatica. So here is an example picture of your Clonorchis sinensis egg or ova. So as you can see, the presence of an operculum opposite a terminal knob. So the knob is not appreciated under this type of picture. No? So it also contains a shoulder, just like here on this drawing. So in terms of the adult for Clonorchis, the adult resembles a bottleneck appearance, just like here. So for the pathology, this is also known as Clonorchiasis, and this is associated with 3 related signs and symptoms. So the first one is cholangitis. So this is the inflammation of your bile ducts. Next is cholecystitis. So this is the inflammation or redness or swelling of your bladder. And lastly, your cholangiocarcinoma. So this is the most significant sequela, which results or contributes to 15% of the cases. And this is associated with the hyperplasia or the increase in size and adenomatous changes of the biliary epithelium. So usually, according to sources, liver fluke infections results in endogenous formation of your N-nitroso compounds. So these N-nitroso compounds are byproducts of liver fluke disintegration. So once your liver flukes dies in your liver, this releases N-nitroso compounds, which is one of the reasons why there is neoplasmic formation. So here in this picture, as you can see, there is a mass forming inside your liver, and N-nitroso compounds are one of the reasons why there is this presence of your tumor. So for the diagnosis of this parasite, the specimen is still stool, and adults can be acquired by using your enterotest and surgical exploration. Again, ELISA and gel diffusion are still the methods for diagnostic. Next is Opisthorchis filineus. So this is a zoonotic disease, which is the cat liver fluke. So this attacks the livers of your cats, and the morphology resembles Clonorchis sinensis but narrower and slightly smaller. The pathology is similar to Clonorchis sinensis but without the presence of cholangiocarcinoma. So in terms of life cycle, Opisthorchis filineus requires humans, cats, and dogs as their definitive host, while the first intermediate host is still snail, and the second one is the fish under the genus Cyprinidae. So the only diagnosis for this zoonotic parasite is PCR or polymerase chain reaction method. So the next one is Dicrocoelium dendriticum. So this is also known as the lancet liver fluke, and it requires ants as their second intermediate host. In terms of their definitive host, cattle and water buffalo are the natural hosts of this parasite, but humans can also be infected by ingestion of infected metacercaria in ants. So when it comes to the morphology, the egg is asymmetrically ovoid with broad convex operculum, while the adults are lancet-shaped. Hence the other name lancet liver fluke, which contains the testes that are obliquely anterior to the ovary, just like here on this picture. So as you can see, the testes, TE, are anteriorly positioned over your ovary. Although not very common, your Dicrocoelium dendriticum can also infect humans and may cause hyperplasia of the biliary epithelium. So this is the similar pathology for Fasciola hepatica, the enlargement of your bile duct system. So the diagnosis for this parasite is through direct microscopy, especially for liver biopsy. So let's move on to the other flukes. We have your intestinal flukes. So the first one is Fasciolopsis busci. So this is also known as the giant intestinal fluke and the largest intestinal fluke of humans and pigs. So this causes fasciolopsiasis, and the target organ of this parasite is the small intestine. So the infective stage is still metacercaria, since this is still under the organ-dwelling trematode, and the diagnostic stage is an embryonated egg. In terms of their life cycle, the definitive host of this parasite is pig, dogs, and humans. In terms of their intermediate hosts, the first one is always a snail, and the second one is aquatic plants, under the species name Trapanatans and Elocaris tuberosa. So the mode of transmission of this parasite is through ingestion of metacercaria in aquatic plants. So when it comes to the morphology, in terms of their egg forms, this is very similar to Fasciola hepatica but is slightly larger and slightly convex operculum. But this is not used to identify the two, but rather the adult forms. So for the adult forms, this is more elongated with unbranched ceca and no cephalic cone, or what we call the shoulders. So here is an example picture of your Fasciolopsis busci and Fasciola hepatica. So as you can see, these are very similar in terms of their morphology. For the adults, your Fasciolopsis busci do not contain shoulders or cephalic cone. But for Fasciola hepatica, as you can see, the presence of your shoulders is evident. For the pathology, general signs and symptoms of ulceration, obstruction, and toxic or allergic signs and symptoms are common for this parasite. So this causes malabsorption syndrome, just like here on this picture. So this is characterized by bad odored loose stool, frequent diarrhea, and so on and so forth. So for the diagnosis, this is still stool as the specimen, and adults can be acquired through enterotest or surgical exploration. So the method is still ELISA and gel diffusion testing. Next one, we have Echinostoma ilocanum. So based from the species name ilocanum, so this is an endemic parasite, or this was firstly discovered in Ilocos region here in the Philippines. So this is also known as the Garrison's fluke, and it causes Echinostomiasis. So the target organ is still small intestine. The infective stage is still metacercaria, and the diagnostic stage is an embryonated egg. So in terms of their life cycle, so as you can see, umiikot yung ating life cycle through the dog, cat, and humans. But in terms of clinical parasitology, humans are the most important definitive hosts. So for the intermediate host of this parasite, your Echinostoma ilocanum, as you can see, the unique snail requirement, no? The first and second intermediate host of this parasite are both snails. Under the genus Hepatois for the first one, and the second intermediate host snail under the genus Kuhol or Pila luzonica and Vivipara angularis or Susong pampang. The mode of transmission is through ingestion of infected snails. So for the morphology, this in terms of their egg, these are ovoid, straw-colored with small operculum. So hindi ko highlight to because these are very general, or they have the same appearance with the other trematodes. For the adults, kindly take note of the attenuated ends of the parasite. So when we say attenuated, these are pointy, no? With circumoral disc with horseshoe-shaped crown of 49 to 51 hooks. So let me show you. So here is an example of a picture for E. elocanum and Fasciola. So as you can see, there is no difference between the two. So these are not used for differentiating the other trematodes. Here is the circumoral disc, which is located at the anterior portion of your Echinostoma ilocanum adult. So as you can see, the presence of your hooks are evident surrounding the disc or the anterior portion of your parasite. In terms of the pathology, this is also known as your Echinostomiasis, and this is very similar to Fasciolopsis buski disease. So this causes catarrhal inflammation, which is, by the way, the ulceration of intestinal wall. So ulceration and general intoxication may also be present for this parasite. So diarrhea, specifically bloody diarrhea, is experienced by the patient associated with abdominal pain. So for the diagnosis, the specimen of choice is still stool. Adults are acquired through enterotest, and ELISA and gel diffusion are still the diagnostic tests for this parasite. So the next one is Heterophyes. So this is under the family of Heterophyids. So these are comprised of your Heterophyes, your Metagonymous yokogawai, and the two Haplorchis species. But in this video, we will be focusing the two clinically significant Heterophyids, which is your Heterophyes and Metagonymous. So the first one is Heterophyes. So this is also known as the von Siebold's fluke, the dwarf intestinal fluke, and the smallest but deadliest fluke in man. So later on, we will be explaining why is it the deadliest fluke in man. So in terms of the pathology, this is also known as heterophysis. So can you guess the target organ of this species or parasite? So since this is intestinal, the target organ is the small intestine. The infective stage is still metacercaria, and the diagnostic stage is embryonated egg. When it comes to the life cycle, the definitive host of this parasite are still humans. Fish-eating animals can also be affected with this, such as your cats, dogs, and birds. So the intermediate host of this parasite, of course, the first one is still snail. How about the second one? Can you guess? So this is under the acronym HAWK. So this is fish. No? So under the genus Acanthogobius. So for the mode of transmission, this is, can you guess? The ingestion of undercooked fish. So now let's move on to the morphology of Heterophyes. So for the egg form of this parasite, this is ovoid or oval in shape with a light brown color and a less distinct shoulder compared to your Clonorchis sinensis. So this is easily confused with the Clonorchis sinensis egg. That's why it's very important to differentiate the two. So later on, we'll be using or differentiating the two eggs of the parasites. For the adult, these are pyriform in shape. So when we say pyriform, these are pear-shaped. So later on, we'll be showing you a picture of this. And remember, for Heterophyes species, this is the only trematode with a third sucker. No? This is usually located at their genital portion of the worm or the parasite. This is so-called gonotile. So here's a side-by-side difference between Heterophyes egg and Clonorchis sinensis egg. So as you can see, for Heterophyes, it has a less distinct shoulder than your Clonorchis. Also take note of the presence of an abopercular knob for Clonorchis sinensis. So here is a sample picture of your Heterophyes species. So as you can see, it is pyriform in shape or a pear shape with a gonotile. This is the third genital sucker for Heterophyes species. So for the pathology of Heterophyes species, this is called heterophysis, and this is associated with peptic ulcer disease or acid peptic disease. So these are sets of conditions characterized by an imbalance between acid secretion and gastric mucosal defenses. So these manifest as peptic ulcer disease, sometimes GERD or gastroesophageal reflux disease, or even stress-related mucosal injury. So patients affected with this particular parasite may feel abdominal discomfort or pain, gurgling abdomen, colicky abdominal pain, and mucoid diarrhea. But what makes Heterophyes the deadliest trematode infection is the ability to be ectopic. So there would be granuloma formation around the heart and brain. So this is where the egg is accidentally transported from the intestine to the other parts of the body, specifically the heart and the brain. So this causes fatal myocardial infarction and valvular damage. For the diagnosis, we can use the stool sample as the specimen of choice for Heterophyid species. This is to recover the eggs of this particular parasite. We can also use modified cathetic method where it uses, just like we have discussed, 50 to 60 milligrams of stool sample, okay, where we concentrate it on a specific template for the highest yield of eggs in a single stool sample. PCR is the diagnostic method. Most of our trematode, ELISA, PCR, and other serological and immunological testing are the diagnostic methods for these types of parasites. So the next one is Metagonimus yakagawai. So this is still under the Heterophids family. So the common name for Metagonimus yakagawai is the yakagawai fluke, and the egg and adult of this particular parasite resembles Heterophyes. So for the pathology, this is still under the Heterophiasis, and the target organ is still the small intestine. In terms of the infective stage, metacercaria is still the infective stage since this is under the organ-dwelling trematodes, and the diagnostic stage is still embryonated egg. So for the life cycle, it is very similar to Heterophyes, so it requires humans and other fish-eating animals as their definitive host. For the intermediate host, the first is still snail, and the second one is fish. The mode of transmission is through ingestion of undercooked fish infected with metacercaria. For the pathology, this is similar to Heterophyes species. So there is ulceration and ectopic granuloma formation around your heart and brain. For the diagnosis, stool is still the specimen of choice, and modified cathetic method is the definitive method, while PCR is the diagnostic method. So now let's move on to the lung fluke, and the only clinically significant lung fluke that we have is Paragonimus westermanni. So your Paragonimus westermanni is also known as the oriental lung fluke, and this causes paragonomiasis. So later on we'll be discussing this. The target organ is basically lungs, but it can also travel to other parts of the body such as the brain, liver, and striated muscles. But remember, there is no maturation for these other sites or other organs of the body aside from the lungs. So the infective stage is still metacercaria, and the diagnostic stage is an embryonated egg. For the life cycle, the definitive hosts of Paragonimus are still humans. Pigs, dogs, and monkeys and other felines such as cats may also be natural definitive hosts. So for the intermediate host of Paragonimus, can you still remember? Of course, the first one is snail, and the second one is crab base. So that is crab. So for Paragonimus westermanni, the second intermediate host is crabs or crustacean. In the Philippines, mountain crab are the most common second intermediate host of Paragonimus westermanni. But in other parts of the US or America, crustaceans such as crayfish may also serve as their second intermediate host. The mode of transmission is through ingestion of infective metacercaria in crabs or crustaceans. For the morphology of the Paragonimus westermanni, the egg is flattened but prominent operculum. So this is similar to dilatum eggs with thickened abopercular knob opposite the operculum. So the adult resembles coffee bean in preserved specimen and spoon shape in fresh specimens. So here is a sample picture of your Paragonimus westermanni egg. So the operculum is very evident since this is still under the organ-dwelling trematode, and also take note of the terminal shell thickening opposite the operculum. So here is the adult form of Paragonimus westermanni. So this is a coffee bean or a spoon shape. For the pathology, this is called paragonomiasis, and the most common infection related to this pathology is your lung infection. So this is an endemic hemoptysis. So when we say hemoptysis, this is the expectoration of blood from the lungs or tracheobronchial tree. So this is characterized by chronic cough and increased production of blood-tinged sputum. So this is usually misdiagnosed as pulmonary tuberculosis because these are very similar in terms of the signs and symptoms felt by the patient. Another related disease for paragonomiasis is the ability to attack the brain. So this is called the cerebral paragonomiasis. So this is the migration of your immature P. westermani organisms or larva to the brain. So this causes seizures and other neurological deficits based on the what part of the brain is affected. So for the diagnosis, the specimen of choice, especially for lung infection or endemic hemoptysis, is bloody sputum, which is submerged into 3% sodium hydroxide. Other methods that we can use is chest radiograph. So this is to check for the severity of your pulmonary paragonomiasis. CT scan and MRI is more helpful in checking the grape cluster appearance for cerebral paragonomiasis. So for immunological and serological testing, immunoblot and ELISA are the best method for these types of parasites. So here is the grape cluster under the MRI of the patient with cerebral paragonomiasis. So finally, we're now on your blood-dwelling trematodes or schistosomes. So these are blood flukes that are associated with 5 different parasites. And the first 3, your Mansoni, Japonicum, and Hematobium, are the most clinically significant ones. For the general characteristics of your schistosomes, their mode of transmission is through skin penetration of infective fork-tailed cercaria. So cercaria is the infective stage of these parasites, and they only require one intermediate host, which is usually a snail host. In terms of their eggs, these are non-operculated but with spines or terminal knobs. For the adults, these are dioecious, which means there is a male and female adult worm. So these are considered the most romantic parasite of man because male worm has gynecophoral canal where the female is held, just like here on this picture. So the bigger one is a male adult worm, while the slender one is a female adult worm. So as you can see, the canal where the female is held is evident on this particular picture. So for the common names, for Schistosoma mansoni, this is also known as the Manson's blood fluke and the profile of a man. For Japonicum, this is the oriental blood fluke, and for Hematobium, this is the vesicle or the bladder fluke. The infective stage of all schistosomes is still cercaria or the fork-tailed cercaria, and the diagnostic stage is embryonated egg. For the target organ, for Schistosoma japonicum, this invades the superior mesenteric veins, draining the small intestine, while for Schistosoma mansoni, in the large intestine, specifically the inferior mesenteric veins, while for Hematobium, the vesicular and pelvic venous plexus of the bladder. In terms of the definitive host, all schistosome require humans as their definitive host, but other animals can also be natural, reserved definitive hosts. For the intermediate hosts, kindly take note for schistosome, they only require one, and that would be the snail species. So for Japonicum, Oncomillania is their snail species, while for Mansoni, Biomphallaria and Australorbis tropicorbis, while for Hematobium, this is under the genus Bulinus or Planorbis. The mode of transmission is through skin penetration of infective fork-tailed cercaria. So in terms of their morphology, the best morphological stage that we can use to differentiate this family is through their eggs. For S. japonicum, it contains a small lateral knob. In some textbook, they also say that this lateral knob is somewhat very hard to distinguish under the microscope. For Mansoni, it contains a prominent large lateral spine. So by the way, when we say lateral, this means it's on the side of the form or the egg form. While for Hematobium, this contains a large prominent terminal spine. So let's test your knowledge in identifying these schistosome eggs. So can you identify the three eggs or pictures of these schistosomes. So if you're done, let's differentiate them. So this is the S. japonicum. So this contains a small lateral knob, just like here on this picture. While the next one is your S. mansoni. So it contains a large lateral spine. While the last one is your S. hematobium, which contains a large terminal spine. For the adults, these are elongated and cylindrical and are considered dioecious. So there is a male and female counterpart. So take note, for the male, it contains a gynocophoral canal where the female is held. That's why it's called the most romantic parasite of men. So let's move on to the pathology of your schistosome, and this is called the schistosomiasis, bilharziasis, or the swamp fever. So the first one is through cercarial penetration. So this is associated with the inflammation at the cercarial penetration site, just like here on this picture. So this leaves a reddish spots where the cercaria entered, and this is also known as the schistosome dermatitis, swimmer's itch, clam digger's itch, and the water itch. So this is an inflammation surrounding the bite site of the larva. Acute infection naman, so this is associated with the Katayama fever or the snail fever. So this is associated with the acute hypersensitivity reaction against the schistosomule, which, by the way, the larval stage present in humans, migrating through the tissues of the patient. So this causes nausea, fever, and eosinophilia. So this occurs 1 to 2 months after the cercarial penetration. So there are ectopic cases as well where schistosomes are related to. So for ectopic cases, we have your urinary schistosomiasis, and this is associated with painful urination and hematuria, or the presence of blood in the urine. So this is associated with S. hematobium. While for cerebral granulomatous disease, this is ectopic eggs being dislodged in the brain area where S. japonicum causes the most cases. So other pathology, ectopic eggs may also be dislodged in the spinal cord of patients where allergic reaction happens. So if there is allergic reaction, there is inflammation and granuloma formation within the area. So this is associated with S. mansoni and S. hematobium. For hepatic or liver complications, this is associated with S. japonicum and S. mansoni. And other sources say for S. hematobium, this may also predispose the patient to squamous cell carcinoma. For the specimen of choice for diagnosis of schistosome, for S. mansoni and S. japonicum, this is stool for the recovery of your eggs, while rectal and liver biopsy may also be used in terms of ectopic cases. For hematobium, 24-hour unpreserved urine is the best sample. Procedures may include mertiolate iodine formalin concentration technique or MIFC, Kato-Katz technique for the quantification, and Foss and Melanie egg hatching technique, or this is parang the counterpart of your Radamori. So for the egg hatching of your schistosome. So for the immunodiagnosis, this is called the circumoval precipitin test of Oliver and Gonzalez. So this is also known as the Fairley's test, and this is the method of choice here in the Philippines. So this is based on the principle of patient serum precipitation with lyophilized eggs or purified live eggs. So this is done by adding 1 drop of patient serum sample onto the bigger hole in the template. Next is to add 1% aniline black plus the lyophilized egg onto the bigger hole as well. Next is to adhere a small adhering or a small insulating tape on top of our template. So this causes the mixing of the 3 samples that we put into the large hole. So if there is the presence of antibodies created by the patient on your serum, the lyophilized egg and the antibodies will interact, causing antigen-antibody reaction. The antigen or antibody reaction causes precipitates around the schistosoma egg, just like here on this picture. And lastly, other species associated with schistosome is your Schistosoma mekongi. So it has a oval, minute lateral spine or knob, and this is smaller than S. japonicum. So for Schistosoma intercalatum, this is associated with rectal schistosomiasis, and it has a elongated terminal spine. So that ends our discussion for trematodes. Thank you and have a good day.